The following segment is sponsored by Medtronic. People with chronic pain live in constant agony, but there is hope. Medical expert Dr. Melissa Murphy and patient Jan Hamilton are here to share new advancements in treating chronic pain. Both of you, welcome to the show.
Thank you.
Of course. All right, Dr. Murphy, this first question is for you. What is chronic pain and what are some treatment options for it?
Chronic pain is defined as pain that's lasting for longer than 3 months and is impacting 51 million Americans. Now, in the past, the treatment options include medication management, injections, physical therapy, and sometimes surgery. But today, we're going to talk about potentially using spinal cord stimulation for chronic pain treatment.
Perfect. All right, Jan, I know this may be difficult, but what are the challenges of living with chronic pain?
The challenge, it's humongous. Everything is affected by chronic pain. There isn't anything that you can do when you're carrying chronic pain around with you because it's always going to be there. So, you know, grocery store shopping or going to work or enjoying things with your grandson at the park. I mean, you're taking that pain along with you and it's debilitating. You know, I live with a pain, or I did live with a pain level of about 8. And so, you know, we could do it, but we got to go. I got to go lay down.
Jan, thank you for sharing that with us. So, Dr. Murphy, tell us more about Inceptiv and actually how it works.
Yes. So Inceptiv is a it's a very advanced spinal cord stimulator. So the way spinal cord stimulator works is that it has a battery and 2 leads, electrodes. It sends electrical signals to your nerve, to your spinal cord to disrupt pain signals from reaching the brain. Now, Inceptiv is a newer generation. It's very special because it uses closed loop technology. So the device actually senses the spinal cord constantly 50 times per second to decide how much energy, how much stimulation the patient needs second to second. So it truly provides a personalized therapy for our patients, and as a result, most of my patients are doing really well with Inceptiv.
Perfect. All right, Jan, you told us a little bit about what it was like living with chronic pain. What has your experience been like after Inceptiv?
Well, it's been a life-changing surgery for me. There isn't anything that I can't do. You know, I'm doing things that I haven't done in years. I can go to the park with my grandson. I can take my dogs. I can play, go work in the garden. There isn't anything that I can't do. You know, he used to say, "Why are you walking like an old lady?" And I'd say, well, for one thing, I am an old lady, but now he doesn't say that anymore. He follows me out the door, and I'm 2 or 3 steps ahead of him, so it's been life-changing. I am so thankful to Inceptiv and to Dr. Murphy for suggesting it.
Oh, wonderful. That's so great to hear. There is hope for those with chronic pain. Dr. Murphy, really fast, can you tell us more about how the closed-loop technology, like Inceptiv, may impact the future of pain treatment?
So unlike the older generation spinal cord stimulation, which uses a fixed output, so it's a constant stimulation to the spinal cord, the closed loop technology has a feedback loop. So the system senses what's going on. The system then uses that information to decide how much stimulation the patient needs second to second, minute to minute. So our patients don't have to adjust their remote anymore. They don't have to adjust their stimulation intensity. They can truly live a life without their remote. They truly live a life without thinking about their chronic pain, and this is the future. This is the next level spinal cord stimulation.
Truly life-changing. Dr. Murphy, where can we go for more information?
So just like anything else, spinal cord stimulation have risks involved and results may vary. So to learn more, go to medtronic.com/pain relief.
Perfect. Dr. Murphy and Jan, thank you. I just gave you a new title, Jan. Thank you, Dr. Murphy and Jan, for joining us.
Thank you.